almost all of these cases are associated with those older style of textured breast implants. So if your doctor is using smooth breast implants, which Dr. Ramanathan and I are, then it's, exceedingly rare.
Hi everyone, welcome to Lipstick and Lipo, your unfiltered guide to plastic surgery. I'm Dr. Smita and Amalfi down in New Jersey, and I've got Dr. Ashley Amalfi, my lovely co-host, up in Rochester. And today, hi Ash, how are you?
Hi, good. Let's do it.
Good. Let's do it. So we're starting a brand new series about breast augmentations and breast implants. And we are literally just going to go and answer all of the questions that you all have. I think, and these are going to be quick, easy
episodes for you to watch.
Yes.
But it is, lots of information packed into quick little episodes to ease your mind when you're looking into a breast augmentation. So we're going to start off, number one, will a breast augmentation increase your risk of breast cancer? So I think it's a big question that comes up in my consultations, right? I'm assuming for you as well, since our patients are the same.
And breast cancer is so common. So it's, everyone always knows someone or is affected by someone in their family or a friend who's dealing with this. So it's always at the forefront of our minds. And obviously for us too, we only want to do things that are safe. And so, right. And so the short answer is no, breast augmentation does not increase your risk of having a breast cancer. It gets a little sticky, right? Because there are older styles of implants that have been associated with increased risks of other cancers. But those are not breast cancer, and those are very, very rare. And those are more associated with certain brands of textured implants, which we just don't use. How about you, Smita?
Exactly. I mean, I stopped using textured implants years ago. So,
and I know you have
a decade,
as well, right?
Yeah, almost a decade.
Almost a decade ago. So so the cancer that Ashley is talking about is anaplastic large cell lymphoma, which, like you said perfectly, it's not your typical breast cancer. So, unfortunately, most of us know someone that's been affected, and we've all been directly affected with breast cancer at some way, but it's not the same. And then there's also some newer reports about squamous cell types of cancers. But again, it's not breast cancer, and it is extremely rare.
Extremely rare. And almost all of these cases are associated with those older style of textured breast implants. So if your doctor is using smooth breast implants, which Dr. Ramanathan and I are, then it's, exceedingly rare, if a never event. So you should feel so safe getting a breast augmentation, whether you have no family history of breast cancer, or even if you have a strong family history of breast cancer, your screening is still the same. It doesn't change. That implant, especially if your implant's below your muscle with your mammogram, they're going to see all of that tissue. None of that is going to be affected. And I have all my patients, if they're about 35 or older, get that screening mammogram before surgery. Do you do that, Smita?
I do. I do it on a case by case. Definitely everyone over 40. I have them get a mammogram, but of course, if there's any sort of risk factors, they're getting imaging beforehand.
Yeah. And then you guys have a baseline, so you know what your breasts look like, and then you have your breast augmentation, and then we get another one afterwards just to see how everything still looks, and you just have your normal screening. So there's no increased risk. And you shouldn't be stressing about it. Just get excited about your breast augmentation, but cancer is not something you need to be worrying about. Just worry about getting that surgery done so that you can look and feel your best.
Exactly. Perfect. Well, guys, this is the first of many episodes, so make sure you tune in, subscribe to Lipstick and Lipo on YouTube and Spotify and iHeartRadio, and we'll see you guys next week.
All right, guys, see you soon.